Hi, welcome to another episode of Talking with Docs. I'm Dr. Paul Zalzal.
And I'm Dr. Brad Wiener.
And I'm Dr. Miles Keeley.
So we have a guest today. We're branching a little bit out of orthopedics and we're going to be talking about a general surgery issue which is the gallbladder. Okay? And actually this is a remake. We already made a gallbladder video, but we didn't like the sound and the lighting, so we're redoing it. It's kind of like a remake, like
Take two.
Like It
Excellent.
or Jumanji.
Excellent. All right.
So what is a gallbladder?
So, good question. Gallbladder is a digestive organ, and it is a bladder, so it's a small sac that's about half the size of your fist, hangs under your liver on the right side, and can act up once in a while and cause some digestive diseases that we often need to surgically deal with.
So, Miles, when someone has a problem with their gallbladder, what kind of symptoms do they show up in the office or in the ER with?
Sure. So, the problem with the gallbladder is if it doesn't empty fully, you can get gallstones that form out of it, and it's those stones typically that can cause the symptoms that we look for. There's two main types of diseases that show up in our office. One is often biliary colic, and biliary colic just means pain that comes and goes. It can last for minutes or hours. It's often related to meals, particularly a fatty meal, and it will often occur sort of high up under the ribs on the right side, goes to the back, to the shoulder. Some people feel a bit nauseated, and it's that come and go with fatty meals that we look for, and that's quite classic for what we call biliary colic. The second thing that we often see is if that stone gets stuck and won't drop away, that develops into something called cholecystitis, which just means the gallbladder's inflamed. And that becomes a bit more of an emergency because the ongoing pain, the potential for infection and complications with that. So that's not quite an elective disease. We often have to deal with that a little bit more immediately through the emergency department, and surgery is often moved up in a more expedient fashion for that.
Well, I am glad that chicken wings don't count as a fatty meal.
It does.
Okay.
Do not listen to that. That's fried food. That is fatty.
Dairy Queen, not
That is fatty as well too. Don't listen
Okay,
to
you
that.
got to sell for ribs.
You gotta So salad. And I often get asked, well, what, if it's the bad fats or the good fats? It's just fat. So you can have like extra virgin olive oil. That's still fat. So that will still stimulate the gallbladder.
Okay, so two things: biliary colic when you're getting some pain, intermittent pain, cholecystitis when it becomes obstructed.
Yeah, and continuous pain, and you can get a bit sicker with that. There are other diseases with the gallbladder too that we probably won't get into. The stone leaves of the gallbladder, you can become jaundiced or turn yellow, you can get pancreatitis and these other diseases. But the two main ones are cholecystitis and biliary colic.
Okay.
How do we treat it?
Surgery, my friend. So two things. One is if you don't do surgery, well, then you just continue with your symptoms and you run a small risk of developing cholecystitis or this inflammation or becoming sicker or getting these complications. So we typically recommend that people get on and have the surgery to take it out to prevent those complications. I always get asked, well, what about if I eat a low-fat diet or if I take these concoctions, will it dissolve my stones? No, it will not happen. The treatment is surgery or no surgery, and that's the decision that we leave to the patients. The surgery, typically for biliary colic, is a day surgery. It takes under an hour to do the surgery, 4 small incisions. It's a laparoscopic procedure. People tolerate generally quite well with some small complications that are potential, but rarely occur. I always tell people take about a week off work and then maybe 3-4 weeks no sports or heavy lifting, and then they're back to their normal selves and feel great again.
Okay,
and get back to eting chicken wings.
And ribs.
Yeah.
Okay, so the complications. What are the complications of surgery?
So the complications are small, but a couple of the main ones are that we can't do it laparoscopically, which are the 4 small incisions with the camera. So we warn everybody there is a very small, about a 1 in 100, if that, risk of making the big old-fashioned scar under your ribs, and that's painful. You got to be admitted to the hospital. It takes a couple of days in the hospital just to get over that pain and a more prolonged recovery, but in the end, you're back to your normal self again, same as you were before. And with any surgery, there's a risk of the anesthetic, just like in orthopedics. It's the same kind of risk. Stretch your heart and lungs a very small amount, very small risk of bleeding, quite small risk of infection, about 1%. And then finally, I always get asked, well, if I have my gallbladder out, how is my life afterwards? Yeah, so...
About 2 pounds lighter?
Something like that. You lose an organ, and the consequence of losing that organ is about 3% of people long-term can have a little bit more frequent bowel movements. And that is about it as far as the
Okay.
long-term consequences.
All right, so we got biliary colic, intermittent pain. You can treat that operatively or non-operatively.
Yeah.
Cholecystitis, that's an emergency. That needs to be treated surgically.
Generally, yes.
Okay. Anything else? Anything else to add? That pretty well sums it up.
That sums up the basic. And then we can get into, I mean, there's other things that the gallstones can do. It can pass out of the gallbladder into the bile duct, causing a really bad infection called cholangitis, which is quite serious, or something called pancreatitis. Again, can be quite serious as well too. But we see that in the minority of time, the majority, it's the colic or recurrent pain, or that constant inflammation, which is the cholecystitis.
Well, thanks a lot to Dr. Keeley for being our guest today. And if you like this video, please like it or subscribe to our channel.
And remember, you are in charge of your own health.
See you next time.
Bye.